Ladies and gentlemen, we're back. As a second portion na po tayo. Nag-uusapan po natin HIV/AIDS. Kaya po meron tayong special guest for today na i-invite po ni Dr. Rowie Medina, no? Dr. Rowie.
Yes, Sunny. We want to ask Dr. Pasumbal regarding the nature of the disease, the nature of HIV. This is from na-expose ka to the time that you will develop the disease, and then to yung buong course niya kung hanggang kailan ka merong symptoms na mararamdaman.
Hanggat mag-manifest na,
yes.
ano? Okay.
Okay. So you can actually divide yung stage or yung natural course ng HIV into 3 stages. No?
Okay.
Yung first stage, yun yung pwedeng asymptomatic yung patient from the time of exposure, or the patient could develop what you call the primary or your primary infection, no? Yung patient could develop yung acute viral syndrome, the acute HIV syndrome, na parang dinaanan lang siya ng trangkaso. It's a self-limiting disorder, no? They present with fever, flu-like illnesses, very non-specific body pain, they develop lymphadenopathy. But during that time, kasi, the immune system is still intact. So the patient will eventually recover.
Okay.
After that stage, you will have the clinical latency. And this is what is unique about HIV. For many years, the patient will remain asymptomatic. No?
So
this
here
is free.
it's up to 10 years, right?
Even up to 10 years, no? Because what happens is, yung HIV, no, from the bloodstream, magtatago sila sa lymphoid tissues.
Okay.
Okay? For so many years. 2 to 10 years. Okay? The patient may be up and about. The patient still has an intact immune system. But little does that patient know na yung HIV na nasa lymphoid organs, little by little, it's killing the immune system already. It's a very silent killer. It distracts, in particular, yung tinatawag na CD4. Yun yung soldier ng body, no, that is being attacked by the virus. Okay? Until the time that the immune system is already very, very low, no, there's already massive immune destruction, no, then you go to the advanced stage of your HIV, or what you call your AIDS, no? So that is the stage 3 and 4, no, classification of your HIV, where the patient will present with what we call opportunistic
Yun daw ang
infection.
pumapatay, di ba? Yan
It's actually the opportunistic infection
It's the complications,
that kills the patient with
Mm-hmm.
HIV as a result of the massive immune destruction.
So they have to emphasize then during the stage 1, during the primary stage, even if they don't have the symptoms, they are infectious.
Already infected.
You can infect yung partners nyo.
Yes.
And during the asymptomatic stage naman din, you can also detect this one, right? So
Yes.
even if they don't, kaya screening is important. Kasi
Yes.
you can detect it. Even
That is
if wala
correct.
silang symptoms.
Okay.
Yes. Although at the early stage of the HIV infection, during this first stage, no, the asymptomatic stage, no, the first few weeks, usually hindi pa yan magpa-positive ang HIV screening. You may have to wait for as long as 6 weeks, no, before the HIV, the HIV antibody test, no, will come out as positive.
Okay. So, yung years,
It may take between 2 and 10 years
2 and
before
10
you
years.
develop the,
Yung AIDS.
or you acquire opportunistic infection. Yun yung nasa stage na AIDS.
so,
No?
yung ubo-ubo, yung papatay na
The
sa'yo.
flu
Yeah.
symptom.
Yung
The
TB.
ordinary.
fungal infection, tuberculosis is a major problem
Pneumonia.
now in HIV. Pneumonia in the immunocompromised individual, mga invasive fungal infection. And we're not only talking about infection here when we talk about the late stage of HIV. We're even talking about cancers. Lymphoma, no, Kaposi sarcoma, cervical carcinoma. Now, this may develop in a patient with an advanced stage of HIV.
Okay.
So what are the symptoms? So once you were diagnosed
Yes.
already,
Okay.
so what are the symptoms?
Okay, what are the symptoms? Well, first, let me emphasize that 95% of these patients may be asymptomatic.
Okay.
Okay? Usually, those who develop symptoms, yun na yung nasa late or advanced
Late.
stage ng HIV. So, when do you suspect? A patient with unexplained fever, for example, unexplained weight loss, unexplained diarrhea, Okay, those with recurrent infection, recurrent pneumonia, for example, recurrent skin and soft tissue infection, herpes zoster is a clinical clue. Now, even simple dermatologic conditions like seborrheic dermatitis are clinical clues to HIV infection. Now, a very important disease that I need to also emphasize is tuberculosis. Okay? In other countries, actually, it's now mandatory that once a patient is diagnosed to have tuberculosis, kailangan magpa-HIV testing.
Especially abroad, it's not common for them to have tuberculosis. So once you go to your doctor and they see you with, and they will diagnose you that you have tuberculosis, they would automatically do
it's
the
a big deal
HIV
for
test,
them, ang TB. The reason being kasi, mataas ang co-infection with TB and HIV.
And STI also.
And STI.
You have to
That is why
also.
when you deal with a patient, no, young patient, biglang nagka-bad case of TB, no, you have to investigate.
Bakit
may risk factor
lang,
ba yan? Bakit biglang nagkagayon ng patient? No? For all you know, the patient might have an underlying HIV infection. That's why HIV testing is also very important, no, for patients with TB infection. So we're not just talking about pulmonary TB, no, but other forms of tuberculosis.
I want to ask this. Yung batas, nakakatulong ba yan? O kayo ba, hindi kayo, meaning the benefits that you get from the law, advantage ba para sa mga...
Actually, merong advantages and disadvantages. Kasi, ang ano dito is yung human rights.
If there are some changes or some amendments that you may want to pursue, ano yan? Anong parte yan?
I would be willing if it will be served as a mandatory testing, no? Kasi yan din yung pinupush ng ibang clinicians, ibang specialists, no? Make it mandatory. But ang importante lang, kahit mandatory yan, counseling should also play a role. Meaning, the patient should still be aware, no? That kahit mandatory, that he should be taking such test. No? Kailangan alam pa rin niya na at kung bakit importante ang HIV testing.
Okay, sa prevention naman, sabi mo rin yung mga high risk, no? So anong tsaka yung myths pala, yung mga perceptions, pero kung...
kasi di ba common na iniisip nila ba sa yung ayaw nila nakasama yung katrabaho yung merong AIDS. Pero sa totoo lang, they're functional. You can't get the virus from just sitting beside them, working with them. So you have to clear yung mga common myths about AIDS,
in a patient with
HIV.
Plain and simple HIV infection lang, wala pang opportunistic infection. No, it's just a standard precaution. You don't get HIV by airborne mechanism or airbound transmission. It's not even acquired by touch. No, so it's just the basic precautions that we should follow. No, of course, pag pumasok na yung opportunistic infection like tuberculosis, no, mag-ingat tayo kasi not for that HIV but for the TB, no, not to get transmitted. But HIV in general, you actually don't need mga extra precautions naman. It's just the standard or what they used to call universal precaution. Na kasi it's very important again to understand the mode of transmission. No? You don't get it by touching someone or
kissing,
even by air or
very low.
kissing.
Kasi sabi nga, how many gallons of fluid of the saliva before you could transfer the virus to the other person.
So it's mainly sexual or by blood transfusion.
When you talk about sexual, yung
IV drug user,
yung intercourse, right?
Yeah.
Tapos yung sabi mo,
we're talking about unprotected.
Unprotected.
No? Be it vaginal or anal intercourse.
Or be it heterosexual, homosexual,
or what you call your MSM group.
Bisexual.
No?
So.
Tapos yung sabi mo, yung high risk ngayon, especially in one area in the Philippines, yung
IV drug use, because they keep on sharing needles.
Tumuturok, no?
Yes.
Para masimple.
That is not a problem. Blood transfusion, not so much of a problem anymore. Kasi meron tayong national HIV screening program.
Pero
so bumaba
merong naka-ano dyan, merong nagka-AIDS dyan dahil sa...
I agree. Kasi meron pa rin mga nadidetect until now, no? Na nagdodonate ng blood na HIV positive pala. No? And it's a good thing we have a very good screening program right now. And of course, yung, as was mentioned by Dr. Rowie, yung mother-to-child transmission.
So breastfeeding.
No?
So,
Yeah, risk din yan for
yes,
HIV
that's why
transmission.
if the patient,
Yeah.
kaya nga ni-screen namin yung mga pregnant patients.
Okay.
Kasi it's part of the screening. Of course, we do the counseling and the consent. So pagka buntis ka and you have and if you have AIDS, tas nagpa-daddy ka, nagpa-breastfeed ka, your
Yun.
baby could get the virus also. Or kung buntis ka, meron ka na, positive ka, the amniotic fluid inside yung baby pwedeng matransfer sa kanya. So, yung mga risk, mga factors na pwedeng i-transfer. But the other ones, do not isolate those patients or those persons who have the virus, di ba?
Huwag bigyan ng, di ba, yung grupong yan, kaya kung minsan ayaw nila magpatingin, dahil natatakot sila yung how the society will
Community
handle
will-
them, right?
Actually,
Look at
sir, it's
them.
still a fact, no, that ano pa rin sila, stigmatized
Yes.
population, no? Discrimination is still an issue, no, in as far as care for people with HIV is concerned. Kaya nandun pa rin sila sa tinatawag natin na hidden population.
Hidden population. Okay. So yung ano naman, prevention.
Okay.
O yung tattoo, no? Natanong mo na yung...
Oo nga, yung body piercing and tattoos.
Body piercing,
Of course, it's the
tattoo.
needle kasi.
Oo,
It's the
needle.
needle use. It's under the needle use kasi. So, as much as possible, single use lang yan and throw it away.
So yung mga nagtatattoo rin, dapat they have to know na...
Dapat
Minsan barka-barkada,
malinis, yes.
di ba? O yes, preso, titirahin lahat
Yes.
yung kakosa nila, titirahin lahat. So, at least yun, pag merong isa sa kanilang merong HIV or AIDS. Okay. Now,
In
sige,
terms
Doc.
of prevention, very basic lang yan.
Ah.
We even call it the ABC of prevention. No? A, no, abstinence. Okay? Especially, mode of transmission natin is sexual. No? So, lessen yung risk for sexual transmission. No? And then B, no, being faithful. No? So, for those with multiple sexual partner, yeah, they have to being
alam ko.
faithful. And then, so last C is control the spread. O sinasabi din naman, condom. Actually, WHO
Yes.
really recommends use of condom.
Especially for
No,
sex
although
workers,
there's may
right?
issue pa yan, no? But it is highly recommended, no, as a preventive
Yes.
measure, no, for transmission of HIV, no? And with the program that we have right now, no, yung what we call yung universal access, we're not only talking about universal access to treatment, but to testing and counseling. No, so we encourage early recognition. No, there are a lot of available HIV proficient laboratory testing centers. So we encourage those at risk individuals, no, to go out there and have themselves tested, because we assure them naman na it is a confidentiality testing. No, they might need, it's voluntary again, no, informed consent may be but let me assure them that it is confidential.
Okay. Pero sasabihin na rin taga-Angeles yan. Si Fernando, ganyan. Pero yung mga pangalan, yung identity, hindi talagang...
Actually, sir, hindi naman yan lalabas kasi
Protected yan.
they protected yung identity.
Oo.
No, they may not divulge it.
Yes.
No, kasi they will be assigned a number. That will be their permanent number.
So let's go back to the letter C, the condom. So
Condom.
you have to educate the public also na baka naman yung condom that you're using has been in your wallet for so long. It's been there. So you have to make sure that the condom that you're using is new or it was not exposed to
It's
the
not expired anymore.
Hindi
Hindi
siya
pwede na-use.
expired. So
And it has to be used properly.
Oh, yes.
No?
Hindi siya
Importante yan.
iniinom.
Yes.
So, hindi lang kasi marami, nasa wallet lang yan in case of
Oo.
emergency. So, ang tagal-tagal na nandun,
Yeah.
tapos gagamitin. So,
Nasisira yung integrity ng
yes,
ano.
oo.
Kasi based on studies,
During
97%
shelf life niya.
efficacy. No, yung
Puputok kasi yan eh. Di ba yung
Yes.
condom, nasisira din yan.
So you always check yung expiration din.
Yes.
Oh, okay. We're gonna have another break,
Yes.
Doc. No? Very interesting discussion, but for some may be alarming, especially for the high risk na tinamaan nung binanggit ni Doc dito, no? Kukontinue pa ho natin to. Kung saan kayo mamaya in the conclusion where they can go, where they can go for testing. Sa Angeles, San Fernando, and the different areas in the country. Okay, babalik po kami mga kaibigan.